Healthcare leaders from across North Carolina are gathering in Raleigh today to raise support for a bill that could expand access to primary care treatment. Hundreds of physicians' assistants will talk to lawmakers today about joining the PA Compact. Savannah Rudisell explains how this is going to impact patients.
The Physician Assistant Compact is essentially an agreement between states to allow PAs to practice medicine in multiple states, different areas that they live in that all recognize the compact. Now, this doesn't change the scope of what a physician assistant can do, but really just where they can do their job. Now, North Carolina's border states of Tennessee and Virginia, they're among the 15 which have already joined. 13 others are considering legislation like North Carolina's Senate Bill 190. Supporters say that there's some potential benefit for rural communities who face a shortage of clinicians. However, they also say big cities like Charlotte, which sit near state borders, and they can get behind the idea just because they can treat clients who are just on the other side of the state line. Now, a similar agreement is already in place for nurses, social workers, and other occupations in several states.
And I think it's been very easy for nurses to be mobile and to kind of go to different areas. And I saw that a lot during the pandemic because I saw a lot of travel nurses. You know, we had needs where I work, but needs across the country. You know, in the future, say there are other disasters, it would make it much quicker to be able to be more mobile to these other areas as well.
Smith says even if this piece of legislation passes during this session, it may take some time before we actually start seeing it up and moving here in North Carolina. He says that things like background checks and making sure that really the complexities on the back end are taken care of by the state medical boards could take upwards of about a year.